Remember, we've talked about this before in other educational series. The source of most problems, and again, this comes down to mitochondria, is too much inflammation, too much low-grade chronic inflammation specifically, and then too much oxidative stress. And so omega-3 can counteract that state of being and make you less inflamed, which in turn creates less oxidative stress. So it's super important to get in enough omega-3. Now, this particular omega-3 has actually got a pretty good ratio of DHA to EPA. Most are the opposite. The difference between DHA and EPA is that the DHA has to do with more of the structure of the membrane, as we discussed, and also DHA is especially important in the brain. So for your cell membranes in the brain and in the nervous system, DHA is hugely important. EPA, like I talked about, is the building block or the just-in-time inventory for the protectin resolvin inflammatory pathway that protects you from attacking yourself after you've cleaned up what you need to do for injury and infection. So hopefully this all makes sense. The nervous system multi I made specifically with higher DHA ratios than most of these omega-3s have for that brain protective function, but it does have a good amount of omega-3 in general with the EPA and DHA that you need. In terms of prescription strength omega-3, I mean, if you've got high triglycerides, your doctor might prescribe you 4 grams a day of this stuff, because that's where the studies show an effective change in your triglyceride and cholesterol levels. That's another reason omega-3s are awesome. They will affect your lipid profile beneficially over time. I take 1,500 milligrams a day. I'm healthy. I don't have any cholesterol issues, but I don't want to. And I don't want to have oxidized LDL floating around in my bloodstream, and I certainly don't want my brain to degenerate. So I take this sort of as a wellness prophylaxis, personal health item for myself. But if you have actual problems with your cholesterol levels, talk to your physician, and they may want to actually prescribe some super high dose omega-3s. But for general wellness, you don't need 4 grams a day. So the basic things about omega-3 that you need to remember: cell membrane integrity, cell membrane flexibility, and protectin resolvin inflammatory pathway, or a balanced inflammatory response to injury and disease. That's why it's important. Hopefully that cleared it up for you.